Amidst the rural healthcare crisis, doctors are finding ways to ease the shortage. The rural physicians are relying more and more on nurse practitioners and physician assistants to take some of the weight off their shoulders.
And they are utilizing new technology to connect with doctors hundreds of miles away. News 5's Kelly Baumgarten joins us in studio with more.
Telemedicine is changing rural healthcare. Dr. Jeff Harrison told me the technology has been extremely successful in eliminating the isolation of small-town physicians. The technology can connect rural emergency rooms to metropolitan hospitals in a matter of seconds. A new piece of technology is revolutionizing healthcare. Many doctors are turning to telemedicine to bandage the problem.
You know, you have cameras in the room, patients come in, and now you've got somebody sitting, 200 miles away, sitting there helping you through traumas, things that you don't see every day.
Some experts suggest allowing nurse practitioners and physician assistants to function to the full extent of their training could ease the doctor shortage. This past session, a bill was presented in the Nebraska legislature that would have granted nurse practitioners full autonomy. But Governor Heineman vetoed the bill.
I relied on the advice of the chief medical officer. It's headed in the right direction. We just thought they needed more experience training, and that's what we suggested, and had it in there, I would have signed it into law.
Dr. Harrison echoes the governor's decision.
By the time a nurse practitioner is done and ready to go practice, they've had 1,000 hours of clinical training. Most of us who train, who go out and practice, realize even at 16,000 hours of clinical training after medical school and residency, still have a lot of things we don't know.
Fewer and fewer young doctors are choosing to practice in rural areas, and the problem comes down to money.
It's always going to be money. The average medical student from here graduates with over $150,000 of debt, regardless of what you go into. When you realize the most lucrative paid specialties are specialties and require large populations, it's a little less attractive to go. It's much less attractive to go out to a rural area.
Some of the barriers are the same barriers that we've had for years, and being isolated as a provider, being on call 24 hours a day, or feeling that responsibility.
But some doctors don't mind the responsibility. Friday night on News 5 at 6, we'll sit down with Dr. Keith Shuey. He's a primary care doctor in the small town of Tecumseh. We'll talk about the issues facing rural doctors.